Hello, everyone. My name is Courtney Spitzer, and I'm the project coordinator for our Early Psychosis Learning Collaborative. Please feel free to introduce yourself in the chat box. Next, I'm just going to go over a few housekeeping items before we begin. Participant microphones have been muted at entry, and you will be able to unmute yourself during the discussion portion. If you have questions during the event or technical difficulties, please use the chat box. This session is being recorded and will be available by the next business day. If you have any questions after the session, please email newengland@mhttcnetwork.org. This slide provides an overview of our disclaimers for MHTTC. The MHTTC network uses affirming, respectful, and recovery-oriented language in all activities. That language is strengths-based and hopeful, inclusive and accepting of our diverse cultures, genders, perspectives, and experiences, healing-centered and trauma-responsive, inviting to individuals participating in their own journeys, person-first and free of labels, non-judgmental and avoiding assumptions, respectful, clear, and understandable, consistent with our actions, policies, and products. And with that, I'm going to turn it over to Dr. Raquel Meshlam-Gately for introductions.
Raquel.
Hey.
Okay, you may be muted.
Sorry, everyone. I was unable to unmute before.
Okay.
So, good afternoon, everyone, and thanks so much for joining us today. My name is Raquel Meshlam-Gately. I am a psychologist from Beth Israel Deaconess Medical Center in Boston and the co-director of the Beth Israel Deaconess site for the New England Mental Health Technology Transfer Center. I'd like to welcome you to today's webinar, which is part of an important series of initiatives we have launched through the New England MHTTC to help support the well-being of all members of the healthcare workforce experiencing an increase in stress-related psychological difficulties resulting from the COVID pandemic. Now, after 2 years of working within this crisis and managing the same types of personal challenges we all have, healthcare workers are experiencing higher levels of stress, vicarious trauma, anxiety, depression, substance use issues, and burnout. Several approaches are available to mitigate as well as prevent these consequences. These include a variety of mental health self-care approaches, some of which we've already addressed through our webinar series, such as mindfulness, yoga, music, positivity, art, sleep, and acceptance and commitment-based practices, and some of which are upcoming, including substance use issues. We will be regularly updating these initiatives on our website, and we'd welcome any suggestions for other resources we can provide. So to that end, I am delighted to welcome my longtime and dear colleague and friend, Dr. Mark Brenner, to address this important topic with a focus on meditation. Among the many hats he wears, Dr. Brenner is Professor Emeritus at Bridgewater State University, where he taught in the School of Social Work. He has over 20 years of clinical experience working with children, adolescents, and adults in both inpatient and outpatient settings. He has studied and practiced Zen Buddhism since 1988 in the Kwan tradition. As a member of the American Red Cross Disaster Mental Health Team, Dr. Brenner volunteers at local and national disasters. His research interests include the use of contemplative practices and the integration of Eastern philosophies into Western psychotherapeutic models. So, without further ado, welcome Dr. Brenner for joining us today to speak about meditation practices for self-care and clinical effectiveness.
Okay, Raquel, thank you very much for that warm welcome, and thank you all for being here today. So I will begin by going over, could we go to the overview, the objective slide? Perfect, great, thank you. Okay, so we're going to be talking about meditation today, and just to give you an overview of what I'll be doing over the next 50 minutes or so, I want to give you an overview of the research, what we know about meditation, what we know about meditation and self-care, and how that can help us work with our clients. And what I'd like to do is to then demonstrate, and we'll practice together some meditation techniques so that you can have the experience of what it's like to practice meditation. And then I want to leave you with some resources that you can use for yourself or share. And I want to say that I'm coming from a mental health background. I'm a clinical social worker by experience, but my sense is that these concepts can be used by many disciplines and by many helping professions. Okay, next slide, please. Okay, so meditation. So meditation comes to us in various forms. Spiritual traditions, some secular traditions, but at core, they all have in common this sense of training. This training, the goal of assisting and helping and leading us to what's happening in the present moment. So it's really a training of attention and a training of awareness. And so that's what we're hoping to get when we practice meditation, to train our awareness and our attention, and which results in multiple benefits that we'll be seeing later. And this meditation helps us with this state of being, which is called mindfulness, which I'm sure many of you have heard of before. Can we have the next slide, please? So I'm using Chris Germer's definition of mindfulness here. But before we talk about mindfulness, let's talk a little bit about mindlessness and what mindlessness is in comparison with what mindfulness is. So mindlessness, some examples of mindlessness would be rushing between activities without paying attention, eating without being aware of how much or what we're eating, feeling to notice how we're feeling or physical sensations we may be having, feeling like our mind is somewhere else. Mindfulness is really a form of awareness that's always present and we can always come back to. And what it is really, as Chris Germer points out in his definition here, it's an awareness of the present moment with acceptance. It's this non-judgmental, gentle focusing of attention of what's happening at hand. And when we're mindful, we're not thinking about the past, we're not thinking about the future, we're being fully present in the moment in our experience. Next slide, please. So we have an example here of two people walking down. And we have trees and we have a sun, and we see the person on the right appreciating the sun, the trees, being mindful. And then we have another version of mindful, which is completely filled with activities, with what happened before, what's music, with all kinds of things. So we're aiming for, in our mindful experiences, to be like the person on the right, not the person on the left. Next slide, please. Okay, so the working components of mindfulness. So what mindfulness does is it allows us to regulate our attention and also to be fully aware of what's happening in our body. And in addition to that, what's happening with us emotionally. And when we have these components going on, it really changes the way that we see ourselves and also the way that we see others. And so this attention regulation, body awareness, and emotional regulation. So a reappraisal of emotional experiences with acceptance and with non-judgment, with being fully present with what is. Now, what the research shows, if we could move on, is that meditation has physical effects, it has psychological effects, and it also produces, in a sense, these mind qualities that we'll be talking about as well. So what does meditation do for us physically, especially when we think about meditation and self-care? Well, what we know from the research is that meditation can lower blood pressure. It also lowers stress responses. It lowers cortisol levels in the body. It also helps us with our immune function. What we're seeing from long-term studies of long-term meditators is that there are actually structural changes in the brain which are occurring. And Sarah Lazar at Harvard and Richie Davidson at the University of Wisconsin in Madison are doing some cutting edge research in terms of how the brain is actually changed by long-term meditation. And what we're seeing in terms of the areas of the brain or the functions are, it changes the areas related to introspection and attention and also emotional processing. So the brain, because of neuroplastic changes, is able to change through the use of long-term meditation practice. And next slide, please. So in terms of the psychological effects of meditation, it helps us to reduce anxiety, depression, and pain. Studies have shown that it actually helps with pain control in terms of long-term pain. And creativity, improves sleep, and we'll talk a little bit about yoga nidra, which is a meditation for sleep, and overall enhances well-being. So we see from the research there are physical effects of meditation, and we can also see that there are psychological effects. Now there are mind qualities which are enhanced by meditation, and that's on the next slide, please. Okay, so the mental qualities that are enhanced through the use of meditation, and this is information from Paul Fulton, who's a psychologist in the Boston area. And really this sense of general acceptance, equanimity, which is this state of balance, this state of psychological stability. We've talked about affect tolerance, being able to tolerate lots of different emotions, and compassion. Compassion, we'll be doing a compassion meditation later today in this session. And it's compassion for ourselves and also compassion for others. And this ability to not know, to be fully present with not having the answer, being able to tolerate ambiguity, and which can really help and enhance our ability to be with clients, to come to clients fully accepting, with compassion, able to tolerate intense affect. And some of our patients can have incredibly intense affect, but to do so in a not knowing stance can help us with our work. So if we think about what the skills are needed in therapy, to be a therapist, to work in lots of different settings, the next slide will show us some of the skills which are needed for clinical practice. So we need to have the ability to engage with our clients, to have a therapeutic presence, to be self-reflective, and really this comfort in not knowing. So if we, now there was an interesting study that was done in 2007, which is on the next slide. And Getmar and his colleagues in 2007 did this interesting research, and it's been replicated in various ways before and since then. But they took 18 therapists in training, and they assigned them to do two groups. One group meditated for an hour a day with a Zen master, and then the other group just had training as usual. And then they, between these two groups, they saw 124 patients. And then they assessed the patients who knew nothing about whether their therapist was meditating or not. They assessed those patients after 9 weeks. And what they saw was that the patients who were treated by the therapists who were meditating showed a better assessment, a more positive assessment of therapy, a reduction in symptoms, and made more progress in treatment. And that the only intervention difference between the two groups was that the therapists were meditating in the group that showed more improvement. So research shows us, and I know from personal experience, that meditation can be incredibly helpful in work with clients. Next slide, please. Okay. So how do we practice meditation? What we're going to be doing today is more guided meditations, seated meditations, but meditation can be practiced standing, it can be practiced lying down, it can be practiced moving, and we'll be talking about some of those types of meditations later in the presentation. But today, we'll be going to be talking more about seated meditation. And before I begin with these practices, I want to say that each of these practices is completely voluntary. So you can join the practice, you can observe the practice, whichever is more comfortable for you. And also, I want to let you know, that when we start the meditation, if it doesn't feel right to you, please stop and just observe. This is completely voluntary. So we'll be beginning now. So I wanted to begin by talking about how we practice, and which will be the next slide. So basic seated meditation. I think that generally, sometimes when we think about meditation, we think about the gentleman on the left, but we're going to be practicing like the person on the right. So what I'm going to be doing is walking you through, in terms of meditation practice, what we do with our feet, what we do with our body, what we do with our breath, and what we do with our mind. So in meditation, in seated meditation, we have our feet placed in the floor, sitting in a chair, and we're sitting with a natural curve to the spine, if that's comfortable for you to do so. And generally it's more helpful if you sit away from the back of the chair, so there's a natural curve to the spine. Your hands can be gently resting on your lap, chin slightly tucked in, and you can practice meditation with your eyes open or with your eyes closed. Generally, it's recommended to practice with your eyes open. If you practice with your eyes closed, sometimes you tend to get more sleepy. Practicing with your eyes open, you gently focus them maybe 2 or 3 feet in front of your feet with a gentle gaze. So that's what we do with our body. We're sitting in what's called an upright and dignified position. In terms of our breath, what we do with our breath. So in meditation, breathing is abdominal breathing. We're breathing down into the belly. As adults, we tend to breathe up here in our chest, but in meditation, we want the breath to be deep and easy. So an in-breath, you'll feel your belly rise, and then the out-breath, you'll feel your belly fall. And it may be helpful in the beginning to even put your hand on your belly to feel the belly rise on the in-breath and fall on the out-breath. And so we're breathing deeply, abdominal breathing. And lastly, what you do with your mind. So today, for these first couple of meditations, we're going to be focusing on the breath, and that's going to be the object of our attention. what'll happen is you'll be focusing on your breath, and then your mind will begin to wander. It happens to everyone. My mind, after many years of meditation, my mind still wanders. But what I'm probably at this point here pretty easy with myself and say, okay, there I go again, and simply bring the mind back. So when your mind wanders, simply and gently and without judgment, bring it back to the breath. It's been described as similar to training a puppy to sit. And so you ask the puppy to sit, and then the puppy gets up and walks away, and you say, no, sit. And the puppy sits and gets up and walks away, and then, no, sit. So the same thing happens with your mind. Your mind will wander, simply bring it back, bring it back, bring it back, bring it back. So what we do with our body, our upright and dignified position, our breath, abdominal breathing, and mind focusing on an object of attention. And then when your mind wanders, simply bring it back. Okay. Next slide, please. Okay. So we're going to practice a following the breath meditation. And in this meditation, what I'd like you to do is to sit upright, dignified position, and simply follow the breath. Breathing in, the belly rises. Breathing out, the belly falls. Following the breath, one after the other. And as you're breathing in, you may want to say to yourself, breathing in. Label it as breathing in. And as you breathe out, you may want to label that as breathing out. So breathing in, breathing out. Breathing in, breathing out. And I'll just let you breathe in and out just for a couple more minutes. So breathing in, you feel your belly rise. And breathing out, you feel your belly contract. You may feel your breath on the tip of your nose as the air comes in. And then as the air goes out. Okay. So that's a following the breath meditation. Very, very simple, can be used anywhere, but simply bringing your attention back to your breath. It's an object of meditation, which you always have. To kind of supplement that meditation, the next slide is a hand trace meditation. And the hand trace meditation is basically just using your hand as an object of controlling your breath. And you have your hand up, and then your finger on the bottom of your thumb. And as you breathe in, you bring your finger up, and then you breathe out, your finger goes down. And breathing in, finger goes up and down, in and down, in and down, and in and down. And you can use one hand, both hands. If you're doing this with children, you can call this starfish breathing or roller coaster breathing. And it's sometimes for some people a helpful way of kind of breathing in and breathing out, breathing in and breathing out. So hand trace can be very helpful as well. Okay. Moving on, a 3-minute breathing space. So a 3-minute breathing space consists of 3 components: awareness, gathering, and expanding. And this is a mini meditation method, which was developed as part of MBCT. MBCT is mindfulness-based cognitive therapy. It's a therapy which is used for treating depression. And it's really an opportunity to become mindful in the midst of a busy life. And what it asks of us is that we shift from a doing perspective to a being perspective, from automatic pilot to awareness, and to deliberately change our relationship with whatever we're experiencing at the time. And so there are 3 distinct phases to this meditation, 3 distinct stages, really: awareness, gathering, and expanding. And in awareness, we stop and we notice what's going on with our inner experience. In gathering, we draw our attention and hold it to the breath and the breathing sensations. And then in the third stage, we expand from the breath to what's happening with our body, to what's happening around us. And so I'm going to walk you through this 3-minute breathing space at this time. And it's really possible through the use of this to step out of automatic pilot. And so please begin by noticing your posture. Straighten your spine and gently relax the body. And then with your eyes either open or closed, silently say to yourself, what is my experience right now? What is my experience in my thoughts? What is my experience in my feelings, in my bodily sensations? Just recognize and accept your experience right now, even if it's unwanted. So just spend a minute or so just noticing what's happening, noticing your experience right now in your thoughts, in your feelings, and in your bodily sensations. And then, as we move on to gathering, gently redirect your full attention to your breathing, to each in-breath and to each out-breath as they follow one after the other. Try noting in the back of your mind, breathing in and breathing out. Or you could even count your breaths, breathing in and breathing out. You can say 1, breathing in, breathing out. You can say 2, you can get up to 3 and then start with 1 again. And do this for the next minute or so as best you can, using your breath as an anchor to bring you back to the present and help you to tune into a state of awareness, and stillness. Using your breath as an anchor. And now we'll be moving on to expanding. Now open your field of awareness around your breathing so that it includes the body as a whole, your posture, facial expression, including any sense of discomfort, tension, or resistance. And if any of these sensations are present, just bring your awareness to them by breathing into them. And then breathe out those sensations, softening and opening with the out breath. So using your breath to expand your awareness to including the whole body and also including any sense of discomfort, tension, or resistance. Okay. Okay. So that is the 3-minute breathing space. And we can schedule these breathing spaces anytime during the day in the midst of daily activities. It really helps to put you in touch with your present experience. And we'll be learning more about awareness and reactions through this, and also noticing how sometimes we might be resistant and fight what's happening at the time. But the breathing space can really help to befriend us and to help to accept some maybe unpleasant experiences that are there and help us to begin to cope with them. You can adapt this so that it works for you, but the aim is really to maintain awareness of the present moment and shift your attention from doing to being as best you can. So that's what we call the 3-minute breathing space. I'd like to move on to a longer meditation, which is the loving kindness meditation. And the loving kindness meditation is a 10-minute meditation, and it's a 10-minute guided meditation focusing on compassion. What the research shows us is that loving kindness meditation can be incredibly helpful in increasing compassion and empathy, and has been used by therapists to develop clinical skills. It's done by focusing on, first would be focusing on a mentor or a benefactor, somebody who we have unconditional positive regard for, then compassion to the self, a neutral person, a difficult person, and then all beings. So this is as I said before, 10-minute meditation, and we'll be going through this. So this meditation begins by taking a moment to be aware of any thoughts or feelings you may be experiencing right now, acknowledging how things are for you. And when you're ready, begin by bringing attention to the body, feeling your feet on the floor, your legs or hips, your lower and upper body, your arms, your shoulders, your neck, your head. Begin to feel the movement of your breath, the actual sensations of breathing, reminding yourself that you're here, alive, and whole. And when you're ready, bring to mind the image of a person who you know or who you've known in your life to be loving and kind to you. someone who easily evokes feelings of warmth and love. It could be a spouse or partner, could be a parent, a grandparent, a family member, a mentor, an elder, a close friend, someone who's been good to you, someone who helps you feel safe and whole, whose caring easily emanates from them to you. And if a person past or present doesn't come to mind for you right now, then maybe think about someone who you know to be inspirational, someone who you could easily imagine sending wishes of well-being to, wishing them well, and hold this person, either the person that you know or the person who is inspirational, hold them in your mind's eye and imagine saying silently to them while holding them in your mind's eye, may you be happy, healthy, and whole. May you have love, warmth, and affection. May you be protected from harm and free from fear. May you be alive, engaged, and joyful. And may you experience inner peace and ease. Now take a few moments now to feel what it's like to wish these things to that person. Letting yourself have the sense of the wishes for well-being emanating from you to them, connecting you to them. Noticing how it feels inside you as you send these wishes of well-being to this person who you love and care about. And when you're ready, seeing if you can imagine this person wishing you the very same things that you wished for them, knowing that they have your well-being in their heart, and imagining them saying to you, may you be happy, healthy, and whole. May you have love, warmth, and affection in your life. May you be protected from harm and free from fear. May you be alive, engaged, and joyful. May you experience inner peace and ease. And as you imagine this person saying these phrases to you, let those feelings just wash over you. Feeling their unconditional love and caring for you, letting the feelings of love and safety grow in you, knowing that there's nothing you need to do to deserve these feelings or wishes, that they're given freely and without condition. Seeing if you can connect with the meaning of these phrases, even if you might not feel safe and warm completely right now, but knowing that the wishes for you are true. And now see if you can have these same wishes for yourself. Hearing yourself say to yourself, may I be happy, healthy, and loved. May I be safe and protected. May I be alive and free. May I experience inner peace and ease. And now it might even be possible to expand even further to acquaintances, to people you know but don't have a personal relationship with. People maybe you see around town, people in your neighborhood, maybe people who you don't have a strong feeling, positive or negative towards. A neutral person, maybe the person who checks you out at the grocery store, person who brings out your groceries. And then for this person who's a neutral person, say to them, holding them in your mind's eye, may you be happy and healthy and loved. May you be safe and protected, free from suffering. May you be alive, engaged, and joyful. And may you have inner peace and ease. And now, if you're feeling strong and secure, and if you're comfortable with this, you might try extending these wishes to someone who's difficult for you right now. Not necessarily the most difficult person in your life, but someone for whom there's been some sort of frustration or misunderstanding. And in doing this, it might help to remember that just like you, they want to be loved. And just like you, they want peace in their life. And you can say to yourself, just like me, they want to feel happy and joyful. And holding this person's image in your mind, just like me, they want peace and ease. And they want to be loved and know that their loved ones are safe and healthy. And just like me, they're doing the best they can with the resources that they have. And if it feels possible for you, then silently say to them, may you feel peace and ease. May you have love and warmth in your life. May you be happy, healthy, and whole. And even if this is difficult, there's a value in noticing what it's like to extend the wish, recognizing that you're not condoning their actions, but seeing them as a person who has the same needs as you to be loved, to be safe, and to be at peace. And lastly, if it's possible, remember the people that you've held in your mind's eye through this meditation, and the people that have loved you the most, family and friends, and then extend the circle of compassion and loving kindness to many people that you may not even know, people who live far away, people in other countries and cultures. And as you hold all people in your heart, say to them all, may you be happy and healthy. May you have peace and ease. May you have love and warmth in your life. And now, as this loving kindness meditation comes to a close, take time to appreciate and feel what's been generated through this practice. And even if there have been difficult parts to the practice, knowing that this practice has the potential to increase your sense of aliveness, your sense of connection, your sense of belonging. And when you're ready, letting yourself again feel your physical presence, the sensations of your body, your feet, your upper and lower torso, your neck and your head. And also begin to notice the movement of your breath, bringing aliveness and nourishment to your body as a whole, just as your wishes of goodwill bring aliveness and nourishment to those around you. And that ends the loving kindness meditation. And so we'll gather back together. And as I mentioned at the beginning, loving kindness meditation really has this capacity to foster and to build positive emotions and empathy. It also helps with self-care. It helps with stress reduction. And you can find recordings of this meditation online. There are scripts online. So find one that works for you if you want to pursue this type of meditation. As we turn our attention to other forms of meditation, if we could have the next slide. There are many forms of meditation. It's walking meditation. One that I use personally, in addition to sitting meditation and Zen meditation, is Yoga Nidra. Yoga Nidra is a guided meditation for sleep, and I find it very helpful if I wake up in the middle of the night and have a hard time getting back to sleep. I'll put on a recording, a Yoga Nidra recording, and listen to that as a way of getting back to sleep. Of course, moving meditation, people know of yoga, Tai Chi, Qigong. And what I would recommend if you want to bring meditation into your life is to choose one practice and practice it for 30 days and see if it works for you. If it works for you, great. If it doesn't work for you, then try something else. I would also recommend, if you want to introduce meditation practice to clients, that you do so by practicing whichever you recommend to you do that yourself first. And that way you can speak from experience when you make these recommendations for practices. Next slide, I want to tell you about two apps for your phone. So the first app on the left, Insight Timer. I use Insight Timer. It's a free app on your phone, and I use it for two things. One is I use it to time meditation. So when I'm going to sit for 20 minutes, 30 minutes, I'll set the timer on Insight Timer, and it will, begin the meditation and also signal the end of the meditation. So I'm not sitting there looking at a clock. And the other app I would recommend is COVID Coach. COVID Coach was put out by the VA, the Veterans Administration. There's actually another version called PTSD Coach for people with post-traumatic stress disorder. And COVID Coach and PTSD Coach both, you're able to put in what you needed, what is going on for you at that moment, and you can then get guided meditations or guided instructions to how to help you with dealing with what's happening at the moment. So I would recommend COVID Coach, and also I use Insight Timer pretty much every day. So I recommend those two apps. In terms of other resources, Courtney, if you can move on to the next slide. Whoops, slide before that, great. Okay, so the two online resources. So I want to let you know about the UCLA Mindful Awareness Research Center at in California, and they have on their website, they have guided meditations, but they're also, the guided meditations are in 14 different languages, including American Sign Language. So if you're looking for meditation practices, guided meditation practices, recordings, they have them there at UCLA, and they also have them, like I said, in 14 different languages. Another resource, online resource that I would recommend is the Schwartz Center for Compassionate Care. And on their website, they have a resource guide for healthcare professionals on coping with the pandemic. And they have some really great resources there, not only just for meditation, but for just self-care in general. And I would really highly recommend checking out their resource guide. So UCLA for guided meditations in 14 different languages, and Schwartz Center for compassionate healthcare. I would really recommend either of those two sites. And at this point here, we have some time left. So if we could move to the next slide, and I'm going to, so Courtney, if there are questions. or comments, we could entertain those now.
Yes, thanks so much for such a wonderful presentation, Dr. Brenner. If anyone has any questions, feel free to just shoot them in the chat box and we'll answer them now.
So it looks like I'm not, or if people want to unmute and ask a question. Okay. So Amanda asked, what challenges have you found in leading mindful activities with people with trauma, and how do you mitigate these challenges? Have you found any forms to be more helpful with working with trauma clients? So I haven't worked directly with trauma clients in a long time. There are meditation practices. I think the thing that you need to be very careful about with meditation and trauma is it has to be done very slowly, so that you're not bringing up material that can re-traumatize the person. So I would just do so very, very carefully when you're working with clients with trauma. Informed consent, letting them know that they can stop. I would also recommend PTSD Coach, and I think that would be a great app for people who are experiencing trauma, because they can, in a sense, control they have control over the app, and they can control exactly what's happening with them at that moment. Do you recommend unguided meditation, just sitting? I practice just sitting myself. Actually, in Japanese, it's called shikantaza, and it's just bare awareness. It can be more difficult, but I find for myself it's been very, very helpful. What I started with is a mantra practice. I started practicing using a mantra a while back, but my practice has evolved to a bare awareness practice, and so it's practicing without guided meditation. And so if you're just sitting, I would recommend using either counting the breaths or a mantra practice. If you have a religious tradition, then I know people that have used the Jesus prayer for meditation. So usually having some type of focus is most helpful. Okay. What is walking meditation? I don't know exactly what you mean by that. Walking meditation, Thich Nhat Hanh, who's a Vietnamese Buddhist monk who actually just passed away, was very, very helpful in terms of walking meditation. And so examples of walking meditation would be, if I'm sitting in meditation retreat, we would sit for a sitting period, 20, 30, 40 minutes of meditation practice. And then we would get up and we would walk single file, but you continue your practice of either following the breath or mantra practice, or but you would do that while you're walking. So instead of sitting, you could do that walking. There's some interesting research that's coming out of Asia and also Finland about forest bathing. of walking in the woods, of being mindful while walking in nature. And there's been some great research that's being done on that in terms of forest bathing. And so walking meditation while being around nature can be very, very helpful. But keeping your mind's eye aware and open and to your current experiences. Okay. So thank you so much for the extra resources. Thank you as well. And benefits of grounding externally, connecting to the environment versus meditation. Or do they tend to provide similar benefits? Externally connecting to the environment versus meditation. So you want, okay. So what you're hoping to do is you're helping to connect your body to be fully present in the moment. And that is a grounding practice. So ultimately, there's actually no difference between your environment. You are your environment, but that's a Zen perspective. So when your mind settles down and you begin to get fully engaged, the separation between inside and outside begins to separate. Okay. Can you speak more about clinical effectiveness? This is helpful intro into meditation. So in terms of clinical effectiveness, what we find in terms of clinical effectiveness, that therapists who are effective at a couple of things. One is they're effective with relationship building, with engaging, and also with the ability to be with a client with a not knowing stance, and to be able to be fully present and engaged in the moment, to be able to hold theory, but hold it in abeyance and let the client's story emerge. And when clients feel heard, when clients feel acknowledged, when clients feel, in a sense, held emotionally, then they can begin to heal. We heal through connection, and we heal through relationships. And meditation allows us as therapists to begin to settle down and to become in touch with what's happening with us outside the sessions. And that allows us to be very effective inside the session with a client. Is it possible to resend the extra resources? So these slides will be available, and they'll be sent out, I think today or tomorrow, and they'll be posted. I think they'll also be posted on YouTube. Vanessa's saying that we'll share these with everyone tomorrow, so they'll be available tomorrow. Okay.
I think there was one more question earlier, if we have time to answer that one real quick.
Sure.
Leah asked, any suggestions for clients that don't like meditations but could really benefit from them? Have you found any alternatives?
Well, I think you have to have a wide definition of what meditation is. So walking outside can be meditation, swimming can be meditation. Any activity that you're doing can be a form of meditation if you bring a mindful awareness to that. And so meditation in some circles can have a negative connotation, and I'm not going to sit and meditate. But you don't have to sit. You can stand, you can walk, you can lie down, you can swim, you can bike, you can run, you can do yoga, you can do Tai Chi, Qigong. These are all forms of meditation. And so having a wide understanding of what meditation is can be very helpful when a client says, I'm not going to meditate. So I hope that's helpful.
Thank you again so much, Dr. Brenner. This
Okay.
was just such a wonderful presentation, and thank you all for joining us. There's a link to our evaluation form in the chat if you have the time to take it. If not today, we'll send it out with our follow-up email tomorrow. So please take a few moments just to fill that out.
Okay.
But thanks again so much, Dr. Brenner.
Okay, thank you, Courtney, for moderating. Thank you, Raquel, for inviting me, and to the Technology Center for hosting this. So have a wonderful day. Thank you all, and take good care.